Welcome back to the Vital Signpost. I think it's safe to say that as nurses and nursing students, we encounter hypertension so frequently that it's practically a constant in our vocabulary. But even though we're so familiar with it, this condition often called the silent killer, you know it can have really serious consequences if we don't address it.
That's exactly right. And that's why we're doing this deep dive today to really get into it. We've got excerpts from two really thorough medical texts, Hypertension, Etiology, Classification, Management, and Crisis, and Hypertension, Pathophysiology, Management, and Nursing Care. And we're going to pull out the most important and insightful information for you. We want to give you the knowledge to improve your patient care and deepen your own understanding of this condition that affects so many people.
Let's get started then. Before we get into all the details of hypertension, let's make sure we're all on the same page about what it actually is. The source material really emphasizes the importance of those blood pressure numbers, and it outlines specific stages of hypertension.
Yeah, the stages are very clearly laid out. Normal blood pressure is defined as less than 120 over 80 millimeters of mercury.
Okay, so less than 120 over 80. Got it. What comes next?
Then we have elevated blood pressure, which is between 120 and 129 over less than 80.
So that's elevated blood pressure, somewhere between 120 and 129 over less than 80.
And this stage is often a warning sign. Research has actually shown that a significant number of people with elevated blood pressure will develop stage 1 hypertension within just 4 years.
Wow, within 4 years. That's a pretty short time frame, so it sounds like early intervention is really important here. What about the next stages?
Sure. So stage 1 hypertension is characterized by readings from 130 to 139 over 80 to 89 millimeters of mercury.
Okay, so 130 to 139, over 80 to 89 for stage 1. And what about the most severe category?
That would be stage 2 hypertension, and that includes any reading at or above 140 over 90.
Got it. 140 over 90 or higher. The source material calls hypertension the silent killer. And it's kind of scary to think that most people don't even know they have it until there's already damage to their organs. This really highlights why we, as healthcare professionals, need to understand how blood pressure regulation actually works.
Absolutely. If we're going to effectively teach our patients and help them stay healthy, we need to know how this whole intricate system operates. You can think of it like a complex dance with multiple systems all working together to keep everything balanced.
So let's break down this dance, shall we? Where do we even begin?
Well, a good place to start is with the sympathetic nervous system, what we often call the fight-or-flight response. This system has a major role in regulating blood pressure. Think of it as your body's internal control center, constantly monitoring and adjusting blood pressure to keep it in a healthy range.
Okay, so the sympathetic nervous system is kind of like the control center, always making sure the blood pressure is where it needs to be. How does it actually do that?
It mainly does this by affecting two key things: heart rate and the constriction of blood vessels. Imagine your blood vessels as a network of highways that transport blood throughout your body. When blood pressure drops, the sympathetic nervous system steps in like a traffic controller, narrowing those highways. We call that vasoconstriction, and that increases the pressure. And when blood pressure gets too high, it signals the vessels to widen, which lets the traffic flow more smoothly and the pressure goes down.
Okay, I like that analogy. So the sympathetic nervous system is really calling the shots when it comes to blood pressure. But it's not working completely on its own, right? There has to be some way to keep it from overdoing it.
You're absolutely right. The body has these amazing checks and balances in place, and that's where baroreceptors come in. These are special sensors located in the carotid arteries and the aorta, and they're like pressure gauges, always checking the blood flow. If the blood pressure spikes too high, the baroreceptors send a signal to the brain saying, "Hey, things are getting a little out of control down here. Time to ease up a bit."
So the baroreceptors are like a braking system, stopping the sympathetic nervous system from sending the blood pressure through the roof. But I'm curious, what happens if that braking system doesn't work properly?
That's an important question, and it's actually something we see a lot in chronic hypertension. Over time, those baroreceptors can adapt to constantly high blood pressure. They become less sensitive to changes, like a faulty pressure gauge that gives inaccurate readings, and that makes them less effective at regulating the blood pressure.
That's a little worrying. It's like our bodies can get used to being in an unhealthy state. Are there other parts of the body involved in this blood pressure balancing act?
Definitely. Another key player is the vascular endothelium. That's the thin inner lining of our blood vessels. It's not just a passive barrier, it actively takes part in blood pressure regulation by releasing substances that either constrict or dilate the vessels. Think of it as a constant tug of war, with both sides fighting for control.
So there's like an internal battle going on inside our blood vessels. Who are the teams in this tug of war?
On one side, you have nitric oxide, which is a strong vasodilator. It's like a peacemaker, encouraging the vessels to relax and widen so blood can flow more easily. But on the other side is endothelin, and that's a potent vasoconstrictor. It makes the blood vessels narrow, increasing resistance and bumping up the blood pressure.
It sounds like that balance between the two is really crucial for healthy blood pressure.
Yeah.
What happens if things get out of whack?
Well, unfortunately, things like smoking can really disrupt that delicate balance. Smoking damages the vascular endothelium, and that makes it harder for it to produce nitric oxide. So the scales tip in favor of vasoconstriction, and that opens the door for hypertension to develop.
It seems like a lot of things contribute to this whole blood pressure regulation dance. What other key players should we be thinking about?
Well, we can't forget about the renal system, especially the kidneys. They play a crucial role in blood pressure regulation, and that's what we'll dive into next. So before we jump into the kidneys and their role in all of this, let's just quickly recap what we talked about already. We've been exploring how blood pressure is regulated, and we've covered the sympathetic nervous system, that control center, the baroreceptors, the braking system, and the vascular endothelium where that constant tug of war is happening.
Yeah, it's amazing how all these different parts of the body work together, isn't it?
Mm.
But now, let's get to those kidneys. They're essential for keeping our blood pressure balanced, right?
Exactly. You can think of the kidneys as the body's filtration system. They carefully control the balance of sodium and water, which are both really important for blood volume, and that, of course, affects blood pressure.
Right, that makes sense. If the kidneys hold on to more sodium, they'll hold on to more water too. And more water means more blood volume, which means higher pressure in the blood vessels.
Precisely. To keep that balance just right, the kidneys use this really intricate system of hormones and enzymes. It's like a complex orchestra with everything working together in harmony. One of the most important pathways in the system is called the renin-angiotensin-aldosterone system. We usually just call it RAAS.
RAAS, yeah. It's one of those terms you learn in physiology, but I have to admit I don't remember all the details. Could you break it down for us?
Sure. Imagine RAAS like a chain reaction that starts when the kidneys sense that blood pressure is dropping or maybe sodium levels are getting low. Their response is to release an enzyme called renin into the bloodstream.
Okay, so renin is like the first domino in this chain reaction. What happens after that?
Renin goes to work on a protein that's already circulating in the blood called angiotensinogen. It changes angiotensinogen into angiotensin 1, but angiotensin 1 is just a middleman. It's not the main player. It gets converted into angiotensin 2.
Angiotensin 2, right. That's the one that really makes a difference in blood pressure.
Exactly. Angiotensin 2 has these two main powers that let it control things. First, it's a powerful vasoconstrictor, so it makes those blood vessels narrow, which directly increases blood pressure. But its influence doesn't stop there.
What else does it do?
Angiotensin 2 also tells the adrenal glands, which sit on top of the kidneys, to release a hormone called aldosterone.
Aldosterone. That's the hormone that helps control sodium and water balance, right?
That's right. Aldosterone acts like a messenger, telling the kidneys to reabsorb more sodium from the urine back into the bloodstream. And wherever sodium goes, water follows. So this extra sodium and water in the blood increases blood volume, and that pushes the blood pressure up even further.
It's amazing how it's all connected, isn't it? The nervous system, the blood vessels, and now the kidneys, they're all working together to keep that blood pressure in check.
You got it. It really shows how complex and interconnected our bodies are. But just like any complicated system, there's always a chance that something can go wrong.
And that's when we start seeing problems like hypertension. So these disruptions in this delicate balance, that's what can lead to this condition that's so common.
Exactly. And one way this can happen is when the RAA system gets overactive. If it's stimulated too much, you get too much vasoconstriction and sodium retention, and that pushes blood pressure up beyond what's healthy.
So it's not just the nervous system and the blood vessels themselves, but the kidneys are really key players in causing hypertension too. Are there other players in this orchestra we should be aware of?
We can't forget about the endocrine system. That's the network of glands that produce hormones, and hormones are like powerful chemical messengers that can have a big impact on how our bodies function, including blood pressure.
I could definitely see how hormones would be involved in this balancing act. Which hormones should we be particularly aware of when it comes to blood pressure?
Well, we've already mentioned aldosterone, that key part of the RAAS pathway, but there are others that are important too, like epinephrine. You might know it better as adrenaline.
Oh yeah, adrenaline, that's the fight or flight hormone, the rush we get when we're stressed or excited.
Exactly. The adrenal glands release epinephrine when we're stressed, and it can really affect blood pressure. Think of it like a sudden burst of energy that surges through the body. It makes the heart beat faster and stronger, and it narrows those blood vessels too. All of that together causes a rapid increase in blood pressure.
It makes sense that stress would have such a noticeable effect on blood pressure. Any other endocrine-related things we should keep in mind?
Yes, there's another hormone called antidiuretic hormone, or ADH. It's made in a part of the brain called the hypothalamus, and it's stored and released by the pituitary gland.
The pituitary gland, right, the
Oh.
master conductor of all those hormones.
Precisely. ADH is really important for regulating water balance in the body. When ADH levels go up, it tells the kidneys to hold on to water, so we make less urine, and that increases blood volume, which, as we've already discussed, affects blood pressure.
It's truly remarkable how all these systems are so interconnected, each with its own job to do, but they all work together to keep everything in balance. We've got the nervous system, the vascular endothelium, the kidneys, and now the endocrine system, all playing their part in this blood pressure symphony.
It really highlights how incredibly complex and resilient the human body is. But as we learn more about hypertension, we start to understand how easily that balance can be disrupted.
And with that understanding, we can move on to exploring the various causes of hypertension, which is something that's really important for us as nurses and nursing students. So we've spent the last part of our deep dive really getting into the nitty-gritty of how blood pressure is regulated. We talked about the sympathetic nervous system being that control center, the kidneys doing all that filtering, and of course the endocrine system with its hormones. It's really an incredible interplay of systems, isn't it?
It really is. And understanding these mechanisms, that's what gives us the foundation for figuring out why hypertension develops in the first place, and then, of course, how we can help our patients.
And that brings us to the different types of hypertension, primary and secondary. I've always found this distinction really interesting because it reminds us that we need to look for those underlying causes, not just treat the symptoms.
You've hit the nail on the head there. Primary hypertension, sometimes called essential hypertension, that's the one we see most often. And the tricky thing about it is we often can't pinpoint one specific cause. It seems like it's this combination of genetics and lifestyle factors.
So it's like a puzzle where we might be missing some of the pieces, we can see certain risk factors, but we don't always have the whole picture. What about secondary hypertension? How's that different?
Secondary hypertension is different because there's a clear cause we can identify, and usually it's because of another medical condition. It could be kidney disease, hormonal problems, even some medications. It's not as common as primary hypertension, but it's really important to think about those secondary causes, especially when someone develops hypertension when they're younger, or if the usual treatments aren't working.
It sounds like detective work, trying to put all the clues together to figure out the root of the problem. It just shows how important it is to do a thorough patient assessment and really understand their medical history.
Exactly right. We need to get a detailed history, do a good physical exam, and order the right tests. That's how we find those potential secondary causes.
Okay, let's talk about the risk factors for primary hypertension then. Even though we may not always know exactly what causes it, we know these risk factors are a big part of why people develop the condition.
Absolutely. Understanding these risk factors, that's crucial for educating our patients and figuring out how we can intervene as healthcare professionals. They give us valuable clues to assess a patient's overall risk.
Right, and I remember learning that these risk factors can be grouped into two categories, those we can change and those we can't. It's actually empowering to know we can focus on the areas where we can make a real difference.
Exactly. Those non-modifiable risk factors, those include things like age, family history, and ethnicity. As we get older, our blood vessels naturally lose some of their elasticity, and that increases the risk of hypertension. Family history is a big factor too. It tells us there's likely a genetic component. And then there's ethnicity. Certain groups, like African Americans, tend to have a higher prevalence of hypertension, which emphasizes how important it is to provide care that's sensitive to their cultural background.
It's a reminder that some people are just more likely to develop hypertension because of things they can't control. But it's good to know we can do something about those modifiable risk factors.
Exactly. Those modifiable risk factors, those are the things we can target and empower our patients to take control of. We're talking about things like obesity, eating too much sodium, drinking too much alcohol, not getting enough exercise, dealing with chronic stress, and smoking.
Those are all things we talk to our patients about all the time, right? It's encouraging to know that if we can address these things, we can significantly lower their risk of developing hypertension and all the complications that come with it.
Absolutely. Making changes to their lifestyle, that can be a really powerful way to fight hypertension. Encouraging our patients to eat a heart-healthy diet, get regular exercise, find ways to manage stress, and quit smoking, those things can make a huge difference in their blood pressure and their overall health.
That's a message worth repeating for sure. Little changes can have a big impact. It's not about making them change their whole life. It's about those gradual, sustainable changes that they can stick with.
Exactly. And these lifestyle changes often go hand in hand with medical treatments, especially when someone has more severe hypertension or if lifestyle changes alone aren't enough.
Which leads us to medication for managing hypertension. I remember from pharmacology that there are a lot of different medications out there to treat this condition. It can be a bit overwhelming to keep them all straight.
You're right, there are a lot of options, and it can feel confusing. But if you understand how each type of medication works, it can make choosing the right one a lot easier.
For me, it helps to think about what the medications are actually targeting in the body. Some mainly reduce blood volume, while others work by relaxing and widening those blood vessels, which makes it easier for blood to flow.
That's a great way to think about it. For example, diuretics, they work by making you pee more, basically flushing out extra sodium in water. That reduces fluid volume, and that leads to lower blood volume and lower blood pressure.
Like letting some air out of an overinflated tire. What about the medications that target the blood vessels?
We've got a few different types of medications that focus on relaxing and widening those blood vessels. We call them vasodilators, and these include ACE inhibitors, ARBs, calcium channel blockers, and direct vasodilators.
I know what vasodilation is, but I sometimes get mixed up about how each of those specific types of medications works. Could you give us a quick rundown?
Of course. ACE inhibitors, that stands for angiotensin-converting enzyme inhibitors. They block the action of that enzyme, the one that changes angiotensin 1 into angiotensin 2. By blocking that conversion, they lower the levels of angiotensin 2, which we know is a powerful vasoconstrictor.
So they're basically interfering with that RAAS cascade we talked about earlier, stopping the production of that key player that raises blood pressure.
Exactly. ARBs, or angiotensin receptor blockers, they do something similar, but in a different way. They block the action of angiotensin 2 by latching onto its receptor sites, and that stops it from constricting those blood vessels.
It's interesting how different medications can target the same pathway but work in different ways. What about those calcium channel blockers? How do they help with vasodilation?
Calcium channel blockers work by blocking calcium from getting into the smooth muscle cells that line the blood vessels. Calcium is really important for muscles to contract. So by stopping calcium from getting in, these medications help the blood vessels relax, and that leads to vasodilation.
And finally, there are the direct vasodilators. I guess those just act directly on the blood vessels to make them relax.
That's right. Direct vasodilators like hydralazine and minoxidil, they have different ways of working, but they all relax the smooth muscle cells in the blood vessels, which widens them and lowers blood pressure.
It's amazing how all these different medications, each with their own way of working, give us so many tools to fight hypertension. But with so many choices, picking the right one for each patient must be tricky.
You're right, it is. We have to think carefully about the individual patient's needs, their medical history, their lifestyle, and any other medications they might be taking. It's not a one-size-fits-all situation, and we often have to monitor them closely and adjust the medication to get that optimal blood pressure control.
It shows how important it is to work together with our patients and communicate clearly. We need to involve them in the decision-making, teach them about their medication, and empower them to be active participants in their care plan.
I couldn't agree more. Educating our patients and making sure they're engaged, that's a crucial part of managing hypertension effectively. When we give them the knowledge and the tools they need, they can make informed decisions about their health and really take ownership of their care.
This deep dive into hypertension has been so informative. We've covered so much. We talked about how blood pressure is regulated, all the details of diagnosing and treating it, and the importance of patient education.
We really have. It's a condition that impacts so many people, and it reminds us of the critical role we have as nurses in promoting cardiovascular health and advocating for our patients' well-being.
Well, thank you so much for this fascinating discussion on hypertension. I'm sure our listeners will find it helpful in their practice.
It's been my pleasure. Always happy to dive deep into these important topics.
And to all our listeners, thanks for joining us on the Vital Signpost. We'll be back next time with another deep dive into the world of healthcare.